That's a good turnout.
That's nice.
Nice performance. Nice. Emotionally invested working in the
That's
house.
me, all right.
This felt like a good
I
idea.
do myself.
Oh, these are really nice.
That was a good event.
Was it? Yeah.
Mhm.
It was fun.
Um,
Where was it?
yes, ma'am.
Oh, okay.
I don't know how you ended up with it. All the copies, or the YouTube stuff
I
too,
had one, yeah.
was what? Like, maybe like 15 community members, community leaders that were
Oh,
recognized.
yeah. Mhm.
Mhm. And then they also had their like business awards
The installation.
and their installation of the board.
Wow.
But they go through so quickly, with the whole program.
All right, so it's 3 p.m. We're gonna go ahead and call this meeting to order. Welcome to the Desert Healthcare District Legislative Policy Committee meeting. It's 3 p.m. Do I have a motion to approve the agenda?
So moved.
Second.
All those in favor?
I,
Ready? Agenda approved. Next item is C, meeting minutes. Any questions? On those minutes? No? I'll entertain a motion to approve.
move to approve, even though I will abstain.
I can move to approve and say, and vote yes.
Okay. So I will revoke my motion.
And so
The second?
I'll second it.
Second,
We don't need a roll call. There's gonna be an abstention.
Just by
Okay.
acclamation.
Okay. So,
So I will abstain.
okay. So,
aye.
Carol and I. I send Letty an abstention. Thank you. Our next item is D, public comments. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to no more than 2 minutes. The committee cannot take action on items not listed in the agenda. Public input may be offered in an agenda item when it comes up for discussion and or action. Do we have any public comments?
No, no public comments.
Awesome, thank you. Next item is E, old business, letters of support submission. Is Trish with us now? If not,
She is.
I apologize. I'm in between meetings now, so I'm off camera, but I wanted to just run through a couple things. Yes, we have submitted on your behalf all the letters that were formalized, finalized. They have been submitted to the appropriate policy committee. And I wanted to flag that we have two bills that are out of the group that we agreed to support and have submitted letters on. We have two bills that are set for hearing. The first is AB 2311, which has to do with physician direct employment. That bill is going to be heard in Senate Business Professions and Economic Development Committee on Monday. And the other is AB 2324 by Assemblymember Gonzalez. That is set for June 17th at 9 a.m. And I will be present for both hearings to testify in support on behalf of Desert. The other bills have not yet been set for hearing.
Thank you. Any questions on these items?
I'm guessing that the two that you mentioned are ones that we have covered in the prior. Okay, okay, they're fine, something.
Yes.
Alrighty. How many public comments on this particular item?
No public comments.
Thank you. So next item is F, new business. And Tish,
Yes, sorry. I'm sorry, I missed the agenda item.
so it's the list of legislative priorities. And then the primary election report. It's D,
Yes.
State
Yes.
budget update.
Yep, thank you. So as I mentioned, we have submitted all the support letters for our priority legislation. we'll continue to track that, and we'll absolutely be attending all of the hearings to ensure that we register, in addition to our letters, a public statement of support in the committee hearings. Each week, we will send out a legislative report that will tell you where the bill is currently, when it's scheduled for a hearing, and any other information, a link to all the other information that you guys would need if you have questions in between meetings on any particular piece of legislation. Wanted to touch briefly, as you guys have seen, DBG provided a 2026 primary election readout. We wanted to make sure to get that out to everyone as quickly as possible the day following after the primary. Obviously, California, as you know, is very methodical and can be very slow in counting their votes. But as of yesterday, it is official that Javier Becerra and Steve Hilton will face each other in the general election for governor in November. Governor Newsom has officially endorsed Javier Becerra. Another noteworthy update, Fiona Ma has secured the runoff to the general for lieutenant governor. And then on some of the local offices, I just wanted to flag that Assemblymember Gonzalez has secured his reelection into the general with 44.7% of the vote as of yesterday. I think the other
I have a question though. Is it, you said as of yesterday, this is dated 6/3, so do you have the latest numbers for who Assemblyman Gonzalez is gonna be running against?
as of right now, it looks like it is going to be, I believe it's Obeso Martinez
Okay.
that came in second. We're going to be providing an update to these numbers, as well as an update to our ballot initiative report, because we'll be coming up on a deadline for finalization for ballot initiatives in the next couple of weeks. So we'll be getting this elections report out to you quickly, and then shortly thereafter, you'll receive one on the initiatives as well.
So on that, really quickly, the counties, so there's 3 counties within the Assembly District 36. They report daily after 5. As of yesterday, the percentages look very similar. Jeff still has 44.7. Ida Obeso Martinez, 24.3. Oscar Ortiz, 21.6%, and then Tomas, 9.3%. The votes, of course, are different, but the percentages remain very similar.
Thank you.
You're welcome. Thank you, Trish.
No problem. Let's see. And then, and I apologize for being so quick here, but we're just in between hearings and meetings today. But also wanted to flag that we are in the middle of budget negotiations. And if I could quickly just give you guys an overview of where we are, deadlines that are coming up, and what that's likely going to look like. As you know, the Assembly and the Senate must pass a budget framework by June 15th. That bill framework does not have to be, the governor does not have to sign it by the 15th. The legislature just has to pass it. If they fail to pass a framework budget by June 15th, then the legislature will not be paid. This is a constitutional deadline. And then the deadline to pass a budget is June 30th. The new fiscal year begins on July 1st. So all of that said, right now, the Assembly and the Senate are working together to try to come up with one budget framework. A couple of weeks ago, the Assembly released their plan, the Senate released their plan, and now for the last week and a half and the remainder of this week, they'll be putting pen to paper and coming up with a combined agreement in which they'll present next week in their respective houses. Those bills that will contain the budget framework are AB 109 and SB 109. And then once that's passed, it'll go to the governor. The governor will then determine whether or not to sign it. But the negotiations for a lot of the details will continue on past June 15th and June 30th. There will be a lot of action in what are called trailer bills and budget bill juniors. So some of the more contentious items that will require three-party agreements between the two houses of the legislature and the governor will likely be determined after the deadlines. And those trailer bills are vehicles that help actually direct the spending of the budget. So the budget outlines the framework of the plan, and then the trailer bills and budget bill juniors that follow actually are responsible for spending the money and providing that direction. Once we have an agreement by both houses of the legislature, we will send you all a report on what the major agreements are on, especially as it relates to healthcare funding in response to federal cuts. So I know that a lot of the negotiations were taking place, especially as it comes to tax increases that the governor included in his May revision, were really informed by how a lot of the tax initiatives locally fared in the primary election, most of which did not pass. So a lot of that is still being negotiated, and we'll be sure to provide a budget once there's a two-party agreement and that's passed. And then once we have more information on what an overall budget agreement looks like between the three folks in charge, or entities in charge, I should say.
Thank you, Tish. Any questions from committee members? Tish, do you have any more information on the funding secured for Palo Verde Hospital through the Distress Hospital Loan Program?
I don't right now. I believe that's still being worked out within the budget. I haven't seen that it was in the governor's May revise. I will go back through the Assembly and the Senate's plans to see if there was a line item for that. It is more than likely that they are negotiating between the two houses on that now, as well as any other components of the Distressed Hospital Loan Program. But I will check on that and get back to you guys.
Thank you, because I know that it was announced by our local legislators, but I asked for some more details and they have not provided it, so I wasn't sure if that was already approved or if they were securing it within the budget.
I believe we signed on to a letter as well, urging.
Mhm.
Yes. And so I will follow up, but I have not seen it in any of the budget plans to date, which doesn't mean that it's a lost cause. It just means that it didn't make it into, the Assembly and the Senate come out with their plans in response to the governor's plan, the May revise. So if the governor didn't include it in the May revise, they may not have included it in their plan, but could still be something that is being worked out within negotiations. So I'll follow up on that and see if I can get an update for all of you on that as well.
Thank you.
Of course.
Any public comment on this item?
No public comments.
I thank you. Then we're gonna go ahead and move on to the next item, F2, 2027-2031 Strategic Plan Pillar 3 Engagement. Done?
So this was something I just wanted to bring to you guys, being that it's legislative and has to deal with HR1, the big beautiful bill, and how it affects Californians as well. And so I kind of touched on a little bit yesterday at FNA, trying to be a little proactive for our district, that we want the community to know that we're still caring, and that even though maybe our grant program is going to be held until January, but we're still gathering data, we're still involved, we're still listening to our community. So I wanted to just maybe throw out the fact that maybe we could develop a survey that would go out to our nonprofits and other organizations and our grantees, So basically to just kind of understand from them, their perspective, how it's going to impact them, either their funding or their services or their help. Because there's going to be a lot of cuts between the food, this Medi-Cal, all those different requirements, billing. And so I just kind of wanted to get your guys' idea of if this is something that I think I would like us to go forward with. I think you were on the same webinar on June 3rd that I was on from the California Budget and Policy Center, which I took screenshots and printed them out, but I can always make copies for you guys. It's all about the May revise and the different barriers for seniors and people with disabilities, all this things, kind of like what Trish was talking about in the budget. So I just wanted to get your idea and thoughts on that, with the staff, we can help, develop a survey to go out.
Awesome. Directors, committee members, questions? Comments?
I think it will be a good idea to do a survey and to get that information as soon as we can. So I think by using the list of our grantees, and it could be for the last, the last 2 years. So that way it's a little bit more information. And I know that this past year we've given out more grants than prior
Yeah.
years, but being able to capture some of that data from the last couple of years as well, it'll be good to find out how it is. And I think by us doing this, it is a little bit proactive because we know that it is something that is impacting our nonprofit, and we want to know what to be able to strategize with that information.
Right, and then with that information, we can disseminate it out. So like looking at it as it ties into pillar 3, engagement. So if there's anything that we can do, like some kind of stopgap funding or any kind of resources we can help get other, because it's going to impact everybody. It's not just going to impact the Desert Healthcare District and the nonprofits. It's going to impact the cities. It's going to impact the county. And to Alejandra's point, I was kind of sharing it with him. He was even mentioned doing maybe a future roundtable with the hospitals, the county, the FQHCs, and say, here's the information we got. This is what's going to be impacted. How do we brace ourselves for this, or how do we look to see how we can address it head on, to alleviate any kind of horrible crisis that could come out of this. So there's lots of ways we can like take this information and as part of our new health systems amplifier, looking for how we're start gathering data. I mean, it's gonna be data, and it's gonna be from the
How soon do
community
you
as
think
well.
you could have something out there?
I'm sorry.
How soon do you think?
No, wonders ChatGPT kind of helps a little bit develop the survey. So I was thinking working with the staff, Gracie and Megan and Alejandra are really good at putting these things together and get Will to do constant contact. Then we have our grantees from our fountain list, of grant management. So we could really, and I don't know, maybe even send it out to the counties and to the cities and see how's it going to impact you.
I just want it to be done quickly because I would like to have this discussion, have that information available to the board by our September meeting. So we could target our meetings that where we could have some board discussion and comes out of that September meeting, some direction. So if we do decide to make some funding available, that it could be done, before the end of the year.
Carol, any input?
No, I agree. That's always been a concern of mine about the impact of this legislation on the needs of our communities. So I think a survey would help us a great deal in figuring out where we stand.
Thank you. I like the idea. I think that it's something that we should move forward. I would also like to see what like the next steps would look like, even if they're not concrete, right? Like, hey, like after we do conduct a survey, like I would hate for us to conduct a survey and just sit on the information and data and not actually have any like action plan. So I think I would like to see like, hey, like this could be route 1, this could be option 2, right? This could be option 3. And I think if we can start thinking about what that's gonna look like, even before we design the survey, even before, right? So let's see, so that we can make sure that we're asking the right questions and we're gonna be able to get that information that's gonna help us on what we're gonna do with the data. And yeah, like if it's an initiative, if it's, other programs or supports that we're gonna be able to like provide the community, I think I'm all for that. And within the time frame, I mean, I guess September, we're
Yeah.
looking at
If we can do
2
it,
months of like prep and then have it ready.
yeah, I like your idea that we do it faster, better than waiting until September, getting the data and then waiting till October. If we can do it concurrently, that would be
Mhm.
better.
And if we, and then we'll leave it up to staff, right, and to design that and see what that gonna look like. And if it's before September, I think, I'm not sure yet if we are gonna be going dark in August. There might be some business that the district needs to conduct, so, I mean, if we don't go dark in August, then we can make it by then, that'd be good, if not.
Yeah, what's even
September.
interesting from that
Mhm.
webinar that we were on, never even thinking, but on the county side, the County Welfare Directors Association were mentioning about how you mitigate the harm. And so they're gonna need more workers to help figure out
Mhm.
eligibility, not saying ways to get around the eligibility, but how you look at all the different circumstances to make sure people are not gonna fall through the cracks,
Right.
especially with that work requirement thing that they're
Mhm.
requesting.
It was, right.
Who monitors that?
Once, yeah.
Stop up.
Yeah. Yeah, on that town hall that I participated in on Friday with DAP and others. One of the things that I was surprised, Nettie, who was the deputy chief operating officer, mentioned that DAP is being proactive and they're actually looking in how they could increase their volunteer program.
Mhm.
So then some of those members that are currently enrolled for in DAP that are potentially going to lose their coverage, of how could they provide a seamless opportunity within their own organization to do volunteer and do some of those activities. So there are some I think are partners, and it would be great to kind of hear some of those, and
Yeah.
how could we support some of those activities? How do we increase their capacity, et cetera? So
Mhm.
they are planning for it, and it'll be great to get their feedback and really paint a good picture from everybody here locally.
I like the idea of survey, I like the idea of the round table, right, bringing them on and stuff. All right,
And I like the idea of being able to act as soon rather than. Thank you for that.
of course, any public comment? On
No
this?
public comments.
All right, any other direction or this? Anything else add that you would like to hear from the committee or on this item?
No, I don't know, marching. Ideas.
All righty.
Thank you for letting me be a visitor to your committee today.
To our next item, committee, member comments,
Let me give you a list of things that I want the legislative committee to do.
please.
You just come for the snacks.
She's complaining because
She needs a water.
all we have is one bag of popcorn.
Oh, we gotta order some more.
And I wasn't the same good as she had yesterday.
Oh, you like the yellow ones, the butter ones.
Yeah.
Carol, any closing comments?
No, thank you.
Alrighty then, well, with that, meeting adjourned.
Thank
Thank you,
you.
everyone.
Thank you.
Thank you. I'll see you at 4 or
Alright.
slightly before. Okay.
Okay, hasta la vista.